Hello, I'm Maria Banos Jordan, the president and founder of the Texas Familias Council, and I'm so happy to be joining you here at the end of 2021. It's been a really tough year for all of us, all our families and communities in dealing with the pandemic and, a lot of the hardships that have come out of the pandemic. So for our council, public health is a major priority. And so we're seeing a lot of the wonderful coming together of collaborative forces, but also a lot of the gaps and weaknesses that have been not long neglected in our communities. And with COVID-19, especially for our immigrant communities and our Spanish-speaking communities, it's been very important for us to get information out in both English and Spanish so that we know that the information, the correct data and the correct information is getting through to our communities. So today I have a very special guest that I wanted to introduce to you. Dr. Daniel Porter is the medical director of the Lone Star Family Health Center. He is a graduate of the University of Texas at San Antonio Medical School and has been a Texan for quite a long time, I believe. So we definitely claim him as ours. And, he's a wonderful, I had the privilege and blessing to have worked with Dr. Porter when I was on the board of directors at Lone Star Family Health Center from 2015. And so I got to see him in action in his various roles, and he's an amazing doctor. He also has a very unique perspective and has done some very wonderful, innovative work in emphasizing the importance of nature on the human mind and body. And so that's, I feel very important, especially for our young, our children, and our families in dealing with these health issues today in a pandemic. So welcome, Dr. Porter. Thank you so much for taking some time out and joining us. And I know you're very, very busy, especially right now during the holiday season, because we're in the middle of a surge or at the beginning of a surge.
That's what it looks like. I think, unfortunately, we're going to have a rough couple of weeks around the county. And it's definitely picked up in the last week for us over here at the clinic. And so, we're also seeing it at the hospital, too.
Oh, yeah. So what are you seeing different with this particular variant than what you were seeing before?
Yeah, so I think it's still a little early in terms of the Omicron variant, as they're calling it, how that's going to play out in terms of severity of illness for folks. I know there's a little bit of encouraging data out of South Africa, where we saw the variant first, and then some data out of England, and that maybe Omicron isn't going to lead to as many hospitalizations and issues as the other variants. But I think that it's still very early to say that. And I think we have to take into account that our population is different from South Africa and our population is different from England. And so our risk factors might be a little bit higher here in the United States, and therefore we may have a larger percentage of our people heading to the hospitals than they did. So I think it's early, but I think we still have to be extremely cautious about what the situation is like now.
I think, it's been obvious. A lot of us are suffering from pandemic fatigue. And so I think we were dealing with Delta, and then we felt like we were kind of overcoming that surge. And so, we've been letting our guard down with the mask use, and especially now with the holidays and gathering. But here comes this next one. And so it is hard. And my concern is one of the things that you just mentioned, which is that hopefully this variant isn't as devastating as previous ones. But I think some people, because of the fatigue, are only wanting to think of that as, well, it's harmless, so I can still get out there and live life as normal. But there are certain groups, right, that you're more concerned about as far as any pre-existing conditions that might be more vulnerable to this.
Right. So I think that evidence is still there that certain groups are at a higher risk, especially if they're unvaccinated or not fully vaccinated. We know that diabetes is a huge risk factor for ending up in the hospital with COVID, and that's going to continue to play out, I think. So diabetes is a large one. Being a little bit heavier, obesity is a second one, and then other pre-existing conditions that lower your immune system. And so, and we know also that in the elderly, the vaccines aren't providing the same level of protection as the younger people. And so, yeah, the idea that even if you're vaccinated, that you can just become completely oblivious and live carefree, I think is it depends on which group of people you belong, in terms of what your risk factors individually. A 20-year-old fully vaccinated with a booster is a completely different patient from your 85-year-old grandmother in terms of her risk. And so I think people need to keep that in mind.
Yes, absolutely. And I think, with messaging, especially concerning the vaccines, that's been an ongoing battle for our council and anyone doing the social work out in the communities. We've seen it as a crisis, as a public health urgency priority, in just getting basic information out and then guiding people to those resources, whether it be testing or vaccinations or other health support that they might need. As far as the vaccines and what we started seeing here at the end of this year has been the push for the boosters, like you were saying. And so I think we've been seeing success in getting a lot of the people that were vaccinated early on, getting those people into the boost. But obviously we still have so many that are fully unvaccinated. What are your feelings about vaccine hesitancy? And, unfortunately, so much of this has been politicized and just tragically used for different reasons, and has raised more questions and confusion in the public arena. So, but how do you talk to your patients about the vaccines and calming some of their concerns?
Yeah, I would say one, we haven't, and believe me, doctors have conversations about if they're seeing any concerning side effects among their patients who they know got vaccinated. And those conversations come up a lot. And really, I have not heard having a complication from a immunization. And we've done, our clinic was part of the effort that did the drive-up vaccination efforts. So we see a tremendous number of patients through our clinic, and a tremendous number of them have gotten vaccinated. And we just don't see concerning side effects from the vaccine. Yes, sometimes people feel rough for a couple of days after the vaccine. And I myself had a couple of days of feeling rough after the vaccine. But in terms of a trade-off between feeling bad for a couple of days and potentially catching COVID and having a severe case, I think we've all felt like that was worth that, a couple of days of feeling crummy. I would say that 100% of our providers here are immunized for COVID. And so there's been that comfort level among all of our physicians here at the center. In terms of other, vaccine hesitancy among certain people that maybe have medical conditions, autoimmune conditions and things like that, that they worry about using vaccines for. Again, the societies like the Rheumatologic Society and other groups of experts have all encouraged patients to go ahead and get the vaccine. And so for the vast majority of people, there isn't a reason to be avoiding the vaccine.
Yes, I mean, we've seen the consequences out in the community of the, especially a lot of our working class communities that are exposed, in their jobs daily. We've seen tragedy, of children losing their parents, over the past, year or a couple of years now. We're entering the third year, which is it's hard to believe this, but we're entering the third year of this pandemic, and we're still struggling, I guess, with some of these concerns. And I understand it's been probably a few generations since we've actually faced a pandemic like this to this.
Sorry.
I don't know if maybe our
I
message.
apologize.
It's okay.
Oh, it was just you had become extremely choppy then.
Oh,
I
okay.
apologize.
Okay. No, that's okay. I mean, I think our connection is a little slow today. I'll try to correct that, but we'll try to get the message through. But I think that it has been a long time since society has actually faced this, like, a pandemic of this extent globally, and so yeah, a lot of this is new, and having to make these decisions, and how we're working together and helping one another. What do you see as far as now with the introduction of the vaccine for children? Are you, is that, I mean, I know it's still very underrepresented as far as 5 and up. Of course, that was just approved here recently, right?
Right. So there's only one of the current available vaccines, the Pfizer vaccine, that's available for children 5 and older. And so, yes, the uptake of that by families has been lower than we would have liked, and because we understand that there are less severe cases among the pediatric population, I think that adds to people's hesitancy in getting the vaccine, when if our pediatric hospitals were overflowing with very sick numbers of kids with COVID, I think that would help, motivate parents to be more proactive about getting their children the shots. And so if you're not seeing or hearing of your neighbors' children ending up in the hospital with this infection, I think that makes the priority for getting the vaccine lower. And that is the reality, is that the number of children who are going to end up in the hospital with an infection from COVID is going to be very low. And that's just a true godsend, that it didn't affect the children more. I think we do have some ongoing concern about, even with a mild case of COVID, what is that doing to that child in the short term and the long term, that we may not be recognizing yet, that we may see 5 years down the road or 10 years down the road, in terms of a impact from that infection that seemed very mild at the time. So
yeah, I think that that's going to be the next ongoing challenge for communities, is the aftermath once we get past this initial stage of the pandemic, is how are we dealing with ongoing long COVID concerns in our communities, and public health, right? How we're reaching and making services accessible to underserved populations, because I think that that's going to be our challenge going forward.
Yeah. And if we're not doing enough testing, if we're not looking at people who even have mild cases, then if something comes out of it down the road, you're not going to know that you had COVID to be able to say, well, 3 years ago I had COVID and now I'm having this issue.
That's right. So mental health is one of the other consequences of the pandemic. And I'm sure with your patients, you're probably seeing some of the consequences of people have been isolated this past, couple of years, or they've been dealing with the hardship of maybe having lost work, marital problems, just all kinds of things on top of the health consequences. How do you see us moving forward with dealing with that as a community, with the mental health piece and the pandemic?
Well, without a doubt, we're seeing the mental health impacts. We have mental health counselors here at the clinic, and their schedules are just so full. And there's so much stress in the community, questions about jobs and and questions about losing loved ones and the economic impacts, of having to take off time from work if you do get ill, and just the daily stress of having to think about a pandemic. So yes, we're definitely seeing it in the impact on kids and teenagers also. So I think there has been some investment from the federal level in terms of trying to get funding out to the public health system because they recognize that we are going to be facing a lot of mental health issues for years to come. And so I'm glad that that investment was made, but it's going to be also, are there going to be enough mental health professionals to help patients? And that's been a struggle for us. It's a struggle for other organizations that we talk to. There's just not the availability of properly trained individuals to help everyone out that needs the help. So
Yes.
there's
And
going to be a big component.
I'm sorry, and especially our bilingual professionals, right? I mean, I think there's always been a shortage in bilingual therapists, and especially today.
Yeah, I totally agree with you on that, and we've been trying to actively recruit that type of person for our patients. Mm-hmm. And I think also people don't recognize that if this Omicron variant is so much more contagious apparently than the previous variants, that even if you happen to have a mild case, getting knocked out of work for 5 or 7 days can be, a huge economic family that's potentially living on one or two, a single wage earner salary, and now that person's having to be out for this. So I think that is another thing that people need to be thinking about in terms of the vaccinations is, yes, you might be in a low risk category in terms of ending up in the hospital or passing away from COVID, but if you can minimize the impact on your health to get you back to work without, devastating long-term or longer-term effects from COVID infection, I think that makes the vaccine also worth it, even if you're not in a high-risk category. So yes, we've seen patients who are in their 20s and 30s who are very healthy people, and when they get hit with COVID, it may take them a good 2 months to get back to where they have the energy level and they don't have the shortness of breath to do their jobs. And so if you have to miss your job for 2 months, a lot of people are going to lose their job in that situation.
Yes.
So the vaccine has that potential of cutting how severe your illness is, and that gets you back to work quickly. So I think that's something to think about too.
Absolutely. And both the Moderna and the Pfizer, I mean, I know this information is kind of coming up quickly as far as how it's holding up against the Omicron variant, but they obviously are providing a significant level of protection from severe illness and hospitalization, right?
Right. I agree with you. They've luckily held up very well. I think, the importance of getting the booster dose when you're eligible for the booster is just adding to that protection. But even if you haven't gotten your booster yet, having the 2 doses of either the Moderna or the Pfizer definitely are helping you out. Now, unfortunately, the Johnson & Johnson vaccine, which was the nice vaccine in that it was 1 shot, that one has not panned out well in terms of protection against Omicron. And so if I was a person that had gotten Johnson & Johnson, I would restart and get on a Moderna or Pfizer regimen.
That's a very good point. Yes. So hopefully, I know we have a campaign that we started in November called Poder de Salud, Power of Health, that is promoting the vaccination education in our community. So, we're partnering with different organizations and going to the community themselves to provide access to the vaccines and also just basic information. That's going to be an ongoing priority, I think, for communities, like you said, going forward, and the long-term effects of the illness. And I mentioned at the beginning a unique piece about, your philosophy and your work focus in including the value of nature in our health. And I wanted to talk a little bit about that in the sense of, trying to stay healthy through a pandemic, especially if we're dealing with issues of stress, maybe some depression, anxiety. What are some of the things that you feel just as a daily routine or a weekly routine that individuals and families can do right now to keep our health, our natural defenses as strong as possible?
Oh, great point. Great point. I think getting outside, because being outside, you're in a much larger volume of air. You're getting good air circulation, and so you can be a little more comfortable being around other people. I think if you're not in a tight knit group outside, but in a spread out in situation outside. I think getting outside, doing some walks, whatever you're capable of physically. Walking as many steps as you can per day. I personally have a bias towards getting a walk out in a nature area instead of down a sidewalk. I think there's been some research that has shown that if you can be the same distance walking on a city street and the same distance in a wooded area or in a natural space, the health benefits are actually better if you can, and your stress levels and things like that are going to be much better if you can be in that natural environment. So highly encourage you to use your local parks, nature spaces, and get out there and just live in the moment of what do the birds sound like? What does the wind sound like coming through the trees? What things can I spot that are tiny, and what things can I spot that are big, and just try to be mindful of that moment rather than just thinking each moment about a pandemic. We've all got, our life stressors on top of a pandemic. So all the things that were happening in our lives didn't stop just because we're in a pandemic. And so I think it's just an additive effect when you throw a pandemic stress on top of that. So check in on your friends, and family. They may be isolated all outside.
Absolutely. I think those are very, very wise words. I think back to, traditional cultures and around the world and our connection to nature, and the lessons that we learned in mindfulness and being with nature, and really the soothing impact of that. And how that is very medicinal to our overall well-being. So, I'm thankful that you were able to share that, because I think people need to be reminded, because the stress sometimes gets us away from using what we have around us, or finding ways to reconnect with nature and one another. So thank you. Well, in wrapping up today's conversation, Dr. Porter, I just wanted to, I know that we'll be sending the children back to school pretty soon. And so I know there's going to be a lot of anxiety and worry about, do they send them back, masking, that sort of thing. From what I have heard, it is very important for the mental well-being of children to be back in their routines. So I didn't know if you had some thoughts on that you could share.
Yeah, I think just as every decision that we make in life has risk and benefits associated with it, getting in your car and driving to work each morning has some level of risk. The risk benefit analysis, that you put to having children in school versus trying to do remote learning. I think we all realize that having the kids in school is the bigger benefit to them. But I would love for us to continue and be pushing for better ventilation, for keeping kids at home the minute they have any type of symptoms. I would love if we had greater availability of testing I think that's going to be an issue over the next few weeks. And some communities are already realizing how hard it is to find a test. And so I'm hoping that the volume of tests can get distributed and get out there so where we can test people. And then if you do test positive, doing the right thing for you and your community by staying home. I've heard of plenty of people who have tested positive and they're not changing their interactions with people. They just think of it as just, well, it's just a cold, let me get out and do what I need to do. And I just ask that you think a little bit more about others, that if you do test positive, to really lock yourself down while you're still ill. The recommendations the CDC just released in terms of 5 days of isolation if you're positive or if you're having symptoms. I think 5 is a little quick. I think we're still thinking about 7 days, being a little bit safer in terms of timeline. But I think, I think the kids have to get back to school, and I think it is going to result in more cases. And so it just puts that onus back on the idea that, yes, if there are going to be more cases, and if you're going to be a person that's in a risk group, that just makes it all the more important that you get out and get the vaccine as quick as you can.
Absolutely. That is the first line of defense, is that vaccine. And I think that we're the big lesson here over the past couple of years has been to understand our limitations and to understand the importance of science and the gift of science to our everyday lives, and how we can incorporate that as reasonable people and being prudent in our behaviors. But I had that conversation today with someone who was confusing the fact of being COVID positive with being ill. So there was obviously a disconnect of, well, if you're COVID positive, but you're not showing symptoms, you're not ill, and therefore you can go about your business as normal. So there are those misinterpretations still among us about, what does that mean? And to understand that this virus is quite efficient and is finding ways to spread and transmit itself, whether the illness appears or not. But I
think that's a really good point. That yes, unfortunately, well, I would say it's fortunate for the person who can have COVID and be asymptomatic, but it doesn't then mean that they aren't able to give it to somebody who's more vulnerable, and that person might get quite ill from it. So.
Yeah, and that's the big connection of community, is that connection between one another that we don't always see, but that is always present between us and among us. So we do affect each other in many, many ways that we don't understand. So Doctor, thank you so much for just, all this important information, the wisdom that you share with your patients, the love and care that you have shown for so many years. I personally am so thankful that, when I have a question out in the field, you get back to me and are able to, guide me with, some information that will help. And so that means a lot to me and to my partners out in the community. And I just want to I hope that we can get all through this and be well and have learned some valuable lessons and improve the well-being and health of our communities overall. So thank you so much. And I wish you all the best in this new year. And I hope 2022 provides us a little respite, maybe at some point from all of this.
I agree. It needs to change for the better, and then we can do some exciting projects and get even more community built. Absolutely. I mean, now actually, the pandemic has really given us a lot of trial and error, a lot of room for investigation and research, and to make us more aware of what is needed at the community level. So I definitely agree that I would love to get to the point of now putting that to good use. So
So thank you so much again. And I guess I also would want to ask if a person is currently feeling ill and having symptoms, obviously isolation, is there a certain point where they should reach out to a medical professional? What is your recommendation?
Definitely. If they're having any trouble with their breathing, to where they're nervous about how fast they're breathing, or being, just something as simple as trying to walk to the bathroom and they're getting winded from just trying to walk to the bathroom. If there's any confusion that you're seeing, in a loved one who might have COVID, if they start to have any level of confusion, if they're unable to tolerate any, liquids and stay hydrated, and also if they feel like they have acutely worsened and they're getting nervous about how ill they're feeling, I think that is the time to come get checked out.
Okay, very good. I think that's very, very good advice for families to be on the lookout. So thank you, and please stay well. And I look forward to talking again soon.
Yeah, thank you.
Thank you.
Everyone take care.
Take care.